What should the paramedic do first? It's a two-step.
Mhm.
24-year-old patient is apneic after suspected opioid overdose.
Okay, stop right
Um,
there. Apneic.
so it's a ventilation problem.
Okay, now, right now that this tells me they're not breathing, what's the next question I have?
Does they have a pulse?
Pulse. Okay, and do they in this case? Yes or no? Pulse or no?
Yes, carotid, strong carotid pulse is present. So we don't do
Okay, so what do I
CPR, but
just
we
what do I describe this situation as?
respiratory arrest,
Okay, so this is, oh, let's do it in purple. This is respiratory arrest, which is what type of problem?
ventilation,
This is a ventilation problem. What's the fix for it?
BVM with an OPA, NPA, or an oxygen.
Okay, BVM, airway adjunct, and O2. Got it. All right, so find my answer.
B, begin positive pressure ventilation with high flow oxygen.
Because this is a ventilation problem. It's respiratory arrest, a ventilation problem. See, all they did is they just gave us a scenario. They put an age in there, but it's still, we got this down to respiratory arrest with which is ventilation. They could have added a whole bunch of details, made the paragraph like 2 pages long. It still came down to this. Make sense? Because what if they just said, instead of saying opiate overdose, they call it alcohol poisoning? What if they call it neuromuscular disorder, myasthenia gravis? What if they call it, what if they say heparin, codeine? What if they say benzo? It doesn't matter. Those are
They're
just
still
details.
apneic.
Yeah, that's what we need to get it down to. This is an apneic patient that's respiratory arrest with a ventilation problem. The fix for that is BVM. Okay, let's go to the next one.
Select the 3 correct answers. So it's two-step. A patient has suspected opioid overdose with respirations of 4 minutes. So it's inadequate. Cyanosis and a pulse. So they're a ventilation problem.
Okay,
Which
so there
actions are
again,
appropriate?
this is not respiratory arrest, but what do I call this one?
Respiratory failure.
This is respiratory failure. It's still a BVM problem. I mean, a ventilation problem with a BVM. So, find my answer.
You need 3. So ignore ventilation because naloxone reverses opioids. No, because it's not your first step. That's too advanced or too expensive.
Nice.
Begin CPR despite